Viewer from Cottage Grove wants to talk about a topic that has been in the news, MNsure. Caller had difficulty signing up through the automated system and ended up with her son on medical assistance, which was not her intent, and having problems getting this fixed. Is anyone working on this? Who wants to talk about MNsure? I guess we'll pick on you, Senator Benson. We'll start with you.
That's just fine. MNsure has not rolled out well, and it has been exceptionally expensive and painful for Minnesotans. It has not accomplished the goal of reducing the number of uninsured. It hasn't made care more affordable or more accessible. Our premiums in the state all went up. We have very high deductibles and really narrow networks, including pharmaceutical formularies and restrictions on what medical devices you can use within your MNsure networks. And so structurally, not accomplishing its goals. People are working on it. We changed directors, and Commissioner Scott Lights, I believe, is a very sincere man. He's exceptionally hardworking, but he is bringing in some outside experts, and the selection will be made next Tuesday as to who the new oversight contractor will be. Now, we don't have a plan to pay for that, and MNsure is structurally in deficit starting in 2015. So there's a lot of work to be done. And as far as the consumer side of things, they are starting to improve some of the customer experience. Call times are going down, but a lot of that's because the broker community has engaged and is assisting people getting through MNsure. Our counties are really struggling because once you put somebody into the medical assistance program, you literally can't change. If they move, you have to write down and contact the insurance company to get their insurance card sent to the correct address. If they have a baby, and babies are automatically enrolled in medical assistance, if mom's on medical assistance, you can't add the baby in the county system. So they have lists and lists and lists of changes that need to be made, and they're having to call the Department of Human Services to get them enacted. It's just not been well done at all, and we've got a long way to go.
Other thoughts?
You know, it's hard to defend the rollout, and I don't think anyone was prepared for the transition here initially. You know, I'd like to apply a historical lens here. I think in the 1960s, you know, I can't remember those days, but you know, we had the rollout of Medicare and Social Security, and you know, controversial programs in their own right. But you look back now, and what would we do without them? And so I think that it's important for us to have patience, but we also have to realize that a lot of Minnesotans have incredible anxiety over this right now, and we can't fix the technical problems with MNsure fast enough, and also we have to just make sure that that there will be choices and options for all Minnesotans. And I know in southeastern Minnesota there's concern over lack of competition and lack of insurance providers and carriers in the area. And so I want MNsure to work, and I think that if any state can do this right, it's Minnesota. We've had a false start here. I'm hopeful that we've learned our lessons, and we're gonna have a good second attempt at this. I have confidence in I think the direction that I see the board going right now. But yeah, it's hard to defend where we are now. And I think what I would ask my colleagues is to have an open mind, and let's fix this. Let's make it work, and let's set the example for the rest of the states in this country on how to apply the Affordable Care Act.
Well, I recognize when I'm sitting across the table from people who are on service committees, and I'm on education committees. Sure. So I won't get in too deep, other than to say that I had a relative who had contacted me. He's a conservative, and he said that hey, I got
one of those families too. Where there's
absolutely. That's how I got to be the way I am. Yeah. So he called me up and he said, I got this letter, and they told me my premiums are going up $200 a month, and Obama this and Obama that, right? And I said, well, I tell you what, I want to, have an opportunity to go through the exchange. And I said, let me, grab your material, and I'll come over, and I want to see how this works. And this was in the weeks, leading up to New Year's Eve. There was no question that the website was difficult to operate. It was about the time that the governor had put the extension on enrollment to try and deal with some of those things. The website, had some very technical glitches. It shut down, and I had to restart it. And it was very frustrating. But at the end of the day, given his tax information, he's a self-employed contractor, and he's got one son. And given his tax information and his family status, he qualified for a certain credit. And he's in that kind of income range where you're trying to get people, encourage them to buy insurance, because they were opting out of the market at one point. And so given the tax credit he qualified for, we were able to easily compare the plans once we got to that point. You could see fact sheets that compared the plans against one another with the same information. It's very easy to read, and he got a plan that gave him comparable coverage at about $150 less a month than he was paying initially. And so, he had to kind of concede that the plan actually worked for him despite all of its difficulties.
It probably hasn't changed the rest of his opinion.
No, I don't know that, but I do know he voted for me. So that's,
Sometimes that happens.
There you go.
Representative?
It's funny that you said at the end of the day, which is actually the average length of people having to. So, bring lunch, have a cup of tea. Just to even step back again, as this thing, you remember this came out of Washington, divided government. They couldn't get Olympia Snowe to vote for this thing. Really? I mean, she's a pretty liberal Republican, and I thought she would be the one they could capture. And so out comes 60-0, and greatly contested, and all one side, and I believe it's like a religion, that this is the thing to do. And then it comes to Minnesota, again divided, and at the end, 100% one side, 0 on the other, and some people like us tried to offer advice. And we offered, the advice I offered, Senator Benson offered advice. It was actually bona fide advice. Mm-hmm. We said, how about if people on the board actually know insurance? How about if we 3.5% is a lot of money to add to a cost? Yeah. We think kicking out a plan that qualifies with all the criteria you've set, this active purchaser, is something that you should just not do and leave the rest of the market alone. This is all over an effort to get 9% of the people insured. Out of the 9% uninsured in Minnesota, 4 or 5% qualify for state programs if they would just go sign up at their county or at the hospital or somewhere. 2 or 3% don't want insurance. They don't need it, they don't want it, they just don't. And then, so really to solve a 2 or 3% problem, we've turned the whole market on its head. And even more ironically, at the end of the day, everybody's gotten carved out except the individuals and the regular people. The big business got carved out, big labor is going to get carved out, I'll predict. Just write that down. The big hospitals, big healthcare, big pharma, everybody big has been given waivers, exemptions, and even now the medium business has got an exemption just by a fiat order. Mm-hmm. And so who's left but the regular people? And it didn't have to be this way. That's my frustration. And I talked before about the bonding bill and respect and the zeal, and the zeal about the minimum wage. I mean, you want to do a good thing, but there's consequences to the good thing, and you have to do a balance and make sure that the good you want to do is not overwhelmed by the bad that may come from something that's unintended. On a good day, we listen to each other, and I'm still preaching that. So,
right. Amen.
Thank you.
I wanted to revisit some of the things Representative Abler said about it, the Affordable Care Act, and of course, I think it was passed in 2009, and it was a 60-0 vote. A lot of people, Democrats, I don't think were entirely enthusiastic about the prospect of it either, because we had envisioned a much different plan, especially if we were going to pass it with 60 Democratic votes. I think that the President moved as far to the center as he possibly could have while holding on to this other side to try and get one single Republican vote. And we knew that this country has the problem of paying the highest rates per capita of any industrialized nation for health insurance, in addition to the highest increases year after year. And we still have large percentages of the population uninsured. And so I guess the question is, after 20 years of talking about health care at the national level, or 30 years, what was the solution? What was the alternative plan? And finally, we've seen one. And, the Republicans, Orrin Hatch, and a few of his other senators out there have rolled out a plan. But, what was the alternative? And then once it was turned over to the states after 2009, there was an entire legislative session where, Representative Abler, you were, very involved. And I guess the question in my mind is, you certainly would have had a lot more leverage to negotiate with the governor at that point in time over an exchange that was more to your liking. And why didn't that happen?
Well, I firmly believe there's not an exchange we could have built that would have passed muster with Washington. Just paying attention to the rulemaking that has come down since this law is enacted is mind-boggling. You cannot keep up with it. And the rulemaking now that they're putting on a Minnesota Care plan is actually bankrupting the plan. The problem isn't necessarily the partisanship, and the problem isn't necessarily how it was enacted here in Minnesota. The problem is Minnesota had good health care, and we had low rates of uninsured, and we had good bipartisan things happening here. Minnesota Care was very bipartisan, respected, and shored up good working-class Minnesotan health care, and it is being destroyed because we turned it over to Washington instead of saying, no, Minnesota knows how to do this. We can do the right thing. We can work together, and we will take care of Minnesotans. And so the federal government forcing their model onto Minnesota instead of us having our own. We didn't need an exchange that was designed by Washington following Washington's rules. We could have kept our systems in place, stabilized our insurance marketplace, kept our costs where we could manage them, and reached out, as Representative Abler said, to those people who were on the margins of being in public programs and actually gotten people insured without spending $180 million, not for one doctor, not for one child getting immunizations, but on an IT system that doesn't work.
If I could just add, I would just caution anybody to make any final judgments on this. Obviously, the rollout of MNsure has not worked out. But when you look at trying to make health insurance work and spread the risk and get more Minnesotans access to health insurance and health care as a result, this is the approach that we've taken. And I think MNsure is a better alternative than healthcare.gov. It's going to be better for Minnesota. There's some kinks, there's some learning involved. You can't defend the problems that we've had. But what kind of lessons can we learn from that? And I hope that, I think the four of us sitting around this table, we could figure out some solutions to this. And I hope the legislature, broadly speaking, is open-minded enough to make this work. But I think when you're trying to extend access to all Minnesotans through health insurance, the key is how do you spread the risk and how do you get more Minnesotans, to sign up for health insurance. And I think technology is going to serve us well. It's just we've got to give it a chance to work. And so I'm optimistic. But obviously, it's been a tough start here.
Well, maybe the thing is we just had too big of a hammer to kill the gnat that we were worrying about. And I think that healthcare should be a state topic, and I think that Mississippi should copy Minnesota. We had in fact, even in the exchange, we had the lowest rates. We already had the lowest rates, so that shouldn't be surprising. We had coverage for the uninsurable. We had MCHA. And we had a plan, which had to be dissolved because the federal rules wouldn't allow it to pay for it. Here we had a functioning, really good system. And that's all. And so I think on the premise, the idea that some well-intended, good people, I don't question motives, in Washington said, we're going to fix the country for this access issue. Didn't cover cost or quality yet. And so if you had to build a federal plan, they should have taken Minnesota and stuck it on the whole country. Sure. Let's go take the great leading ideas from across and put those. And instead it was lawyers and plumbers and candlestick makers designing a system.
Throwing things together.
And here we are. And so I think, well, it's here. And so here we are. So I think your advice is probably prudent.
Can't turn back the clock now.
Yeah.